I'm so glad to be here. And my presentation will really tie well with India's presentation, and I'm so honored to present after her. She's been a great mentor to me, so thank you. So I'm going to focus my presentation on stigma and its influence on health among Latinx immigrants. And by providing a framework on stigma and how it intersects with other identities, I hope to get us thinking about potential strategies to truly integrate and address stigma among this population. And specifically, I'll apply this framework to HIV/AIDS prevention, which is the focus area of my research program, and specifically among Latinx immigrant men who have sex with men. So stigma is a powerful force, and extensive research has demonstrated that it greatly influences determinants of health, and it's also often considered a social determinant of health as well. So through the process of stigmatization, people with minority identities can be targeted, labeled, stereotyped, and marginalized, and oftentimes by groups with more social power. And this process can lead to status loss, discrimination, and victimization. And as a result, it can have a detrimental effect on health at a variety of levels, including access to health, health-seeking behaviors, and also have implications for negative mental and physical health outcomes. So, while there has been a great deal of research on stigma and its effects on health outcomes, the research on intersectional stigma, as India mentioned, has developed much more recently. Specifically, there has tended to be research that has examined unidimensional stigma, or stigma that's assumed to originate from just one target identity or issue, such as race or ethnicity. But assuming that stigma is unidimensional doesn't really account for the complex ways in which social identities interact to produce multiple layers of stigma. And it doesn't integrate how stigma can also be compounded based on different minority statuses such as race, ethnicity, gender, age, etc. So intersectional theory emerged as a phenomenon across different academic disciplines, and it really highlights the complex ways in which social identities can produce multiple interconnecting layers of stigma, and it illustrates that these multiple identities are not and should not be considered independently. So given that when we think about ourselves, we often don't just think about one aspect of ourselves, rather we think about the various intersections of our social locations and how they're very interdependent. And that can mutually and simultaneously shape our outcomes and experiences. So this is particularly important for immigrants as they're a diverse group that often belong to multiple minority and stigmatized groups, which can really increase their vulnerability to experiencing distinct disadvantages. So to relate this specifically to HIV/AIDS, we know that the influence of stigma and HIV has been widely researched, and stigma has been acknowledged as a significant factor that can shape HIV risk and prevention behaviors. So we know that HIV prevention services such as testing or pre-exposure prophylaxis or engaging in safe-sex behaviors are really critical for preventing new HIV infections. But stigma, particularly stigma associated with being HIV positive or having HIV, can trigger negative attitudes, stereotypes, and fear about what that means. So in order to enhance HIV prevention, not only do services need to be available, but people need to access them, they need to utilize them, and in many cases, they need to adhere to that treatment or behavior. But stigma can impact each of those aspects of prevention and behaviors, and specifically stigma associated with HIV at the structural and individual level can pose a major barrier to prevention. For example, it can manifest as prejudice, stereotypes, judgments, which can lead to social exclusion, discrimination, and as a result of those experiences, people can experience shame, fear, and then ultimately mistrust of the system. So when thinking about stigma associated with different identities and stigma associated with HIV/AIDS, we can see that there are many different types of stigma that an individual can experience. And as an example, when we think about Latinx immigrants in the US, we can see that there are several factors or identities that can contribute to stigma and shape their subsequent experiences. And it's not solely stigma linked to HIV/AIDS. For Latinx immigrants, they can be of several minority or marginalized identities. This figure isn't exhaustive, but for example, race, ethnicity, which can be often linked to language barriers, sexuality or sexual orientation for folks who identify as gay or bisexual, or who don't identify as gay or bisexual but still engage in same-sex behaviors. We also know that Latinx immigrants tend to have lower incomes or be parts of lower socioeconomic status groups, which can have implications for education or employment. And finally, immigrant status, which can really shape access to healthcare, social services, have legal implications, and lead to a type of visibility or invisibility given the current socio-political climate that can really have a detrimental effect on health-related behaviors. So immigrant status in particular, which India discussed, it has been stigmatized in recent years, particularly with the current socio-political climate. And as we all know, with greater focus on immigration and immigration policy in the news and other media outlets, it's really heightened this attention on immigrant status. And when thinking about this population and barriers to accessing services, a major component that often comes up, not just in the literature, but in actual discussions with the community, is a sense of concern and fear about the current political climate, specifically related to immigrant status. Even for those who might not identify or who might not be undocumented, the rhetoric and debates about immigrants in general have tended to affect all those who identify as foreign-born or immigrants. And we see that this identity is associated with health disparities, specifically when looking at HIV/AIDS in King County. We see that migrants are a neglected and high-risk group. So to provide some epi background, 21% of residents in King County are foreign-born, yet foreign-born individuals account for 32% of all new HIV diagnoses in 2017. And we see that the diagnosis incidence was also 2.7 times higher among Latinx immigrants compared to their US-born counterparts. And when also thinking about HIV prevention services, such as testing and PrEP, we see disparities as well. So HIV testing is the first step in linking folks to care. And in King County, 29% of foreign-born individuals were diagnosed late, compared to 16% of US-born Latinx individuals. And while current estimates of pre-exposure prophylaxis, or PrEP, which is a medication that can be taken to prevent HIV infection, are similar among Latinx individuals and groups of other racial and ethnic groups, Latinx folks may encounter additional barriers to accessing the medication due to factors such as fear or mistrust of the system. So, given these disparities, it's really critical to understand how stigma associated with the complex identities of Latinx immigrants is a major contributing factor. And notably, as Chandra also mentioned about the socioecologic levels, stigma can manifest at multiple levels. For example, stigma can be internalized or experienced at the individual level or even anticipated, but it's also experienced interpersonally through interactions with others who may have prejudice or beliefs about a specific identity. And that in turn can shape stigma at the contextual or structural level by shaping overall services or facilities that are really able to address the needs and concerns of individuals with that particular identity. And of course, those different levels all intersect as well. And when we think about Latinx immigrant men who have sex with men, their increase in HIV diagnoses in recent years really highlights that higher levels of these different levels of stigma due to their multiple disadvantaged statuses may be linked to these negative health outcomes and these disparities. So to truly understand and address how these different types of stigma may be shaping health outcomes really requires research and measurement of those factors. So through a working group with a couple of colleagues and with the help of some graduate students, I sought to examine how intersectional stigma has been measured specifically to examine its effect on HIV/AIDS related outcomes. So we scoured the literature to first see whether intersectional stigma has been measured, and secondly, to see if stigma specifically associated with immigrant status has been included in those measures. And based on our preliminary search, the results that we saw were that stigma associated with race, ethnicity, sexual orientation, and HIV status were the most commonly identified. And while many of these studies included populations that identify as immigrant or foreign-born, there were limited measures of stigma specifically related to immigrant status. Further, there were limited measures of intersectional stigma. While acknowledging that intersectionality is a very complex concept to accurately measure or really even define, we noticed that most measures of stigma were based on self-reports of experiences of being discriminated against due to a single minority status. And while some measures did assess multiple forms of discrimination due to multiple social identities, it was actually measured by assessing stigma resulting from each social identity independently and then combining those scores to test effects of different combinations of stigma and different identities. So, there could be some critique about whether this additive approach really just sums up different social identities and statuses without attention to how those individual level experiences intersect and are complex. So this preliminary review of the literature just really highlighted a need for more research on intersectionality that measures this complexity, as well as research on intersectionality that integrates immigrant status as an important social identity and contributing factor. So to tie this together, I wanted to bring in some perspectives from Latino immigrant MSMs, specifically about strategies to overcome stigma and different forms of stigma to increase HIV testing and PrEP uptake among this population to really reduce these disparities. So I'm currently doing a pilot study which is focused on identifying feasible and acceptable strategies for HIV prevention among Latino immigrant MSM in the area. And this is part of a larger study to really enhance HIV prevention services among this population. But through collaboration with a community partner, Entre Hermanos, we interviewed 30 Latino immigrant MSM between the ages of 18 and 32 years old, just to get a better sense of their specific barriers to HIV prevention and to assess how social media specifically could be used to recruit and provide them with information about HIV testing and PrEP use. And across the board, folks indicated that social media would be an acceptable and useful approach to provide them with information or to recruit them to get tested or to learn about PrEP, and that this platform could potentially overcome some of their barriers to accessing information. So we further asked, what types of images or messages would they want on these social media platforms? And a major theme that emerged that I want to highlight was first to not further stigmatize HIV/AIDS. And we talked about the stigma associated with HIV, and they really pushed this idea that they didn't want fatalism or negativity linked to HIV. So for example, one person said, don't put something bad like the end of the world if you have AIDS, because before that was the concept. Or don't say HIV is AIDS and you will die. Don't put cruel images to expose people with the disease, for example, something that really has nothing to do with it. So this really highlighted their desire to not create more stigma associated with HIV. And secondly, another theme, and these themes have really emerged in prior research, and this theme was that participants didn't want images that further marginalize them as different. So among Latino immigrant MSM, they did want culturally tailored messaging, but they didn't want it to be really focused on their specific identities as Latino immigrant MSM. For example, they said, truly the message should be universal because for everyone, like I mentioned before, it can happen to anyone. So we aren't people where it's you, yes, you know, you, yes, yes, or you know. You understand then. Create something that's for everyone, something for all. It would help us to create something where everyone is included. So we further probed and asked, so you don't want images or messages that are specifically, that reflect you as a Latino immigrant MSM, and they said, for one, well, it can be embarrassing. Second, you don't want anyone to know you're gay, so if it was something more universal, that would be good. Another person said it's not necessary because we are all human. There isn't anyone with the tail of a dog or the ears of a donkey. We're all the same. So this theme really highlights that they wanted images that were more universal, that they could relate to, but that others could relate to as well. And I think this really highlights that they don't want the images or messages to create more stigma about their already marginalized identities. And these preliminary results just truly bring together the importance of better understanding and measuring stigma from intersectional identities and finding ways to address them that don't further stigmatize particular groups. And through such efforts, perhaps we're able to reduce stigma and address disparities such as disparities in HIV/AIDS. Hence, we truly need research that acknowledges and really integrates the complex intersection of age, race, class, sexuality, gender, immigrant status, and different social identities. And this can hopefully improve our understanding about how distinct and intersecting experiences resulting from these social identities really impact the health of immigrant communities. And there's also an evident need for policies and reform to enhance health and equity and opportunity, particularly for foreign-born individuals. And this will really require attention to identifying ways to address the policing of gender, sexuality, immigration in the US and abroad. And as practitioners in different fields, we can also be mindful of the different identities of our clients when providing services or working with particular groups. And by being mindful of this complexity, as well as the strengths of those identities, that can hopefully help us push for policies and programs that really address the victimization or discrimination that can result from those identities. So I want to thank my colleagues David Katz and Roxanne Karani that really inspired this initial idea to think about intersectionality and stigma and its influence on HIV/AIDS, as well as some of my graduate students who helped me with this work, as well as Entre Hermanos, who I collaborated with on the pilot study, as well as the Institute of Translational Health Sciences, which helped to fund the work. So thank you.